Dr. Anand was our first orthopedic surgeon to join us about 5 years ago when we reopened orthopedics here in Fort Dodge.
As an orthopedic surgeon, you're able to help someone who has been suffering with chronic pain or disabled from an injury, and you're able to get them back to their normal life, back to things that they like to do, and thereby improve the quality of their life. Growing up, I was able to see the kind of impact that my parents as physicians were able to make on their patients' life. I was able to see that my parents had strong work ethics, deep professionalism, and at the same time, they were humble. I believe it's due to these virtues of medicine that I decided to enter medical school.
Oh, wow, that is really neat. So you saw your parents and their great contribution to their community. And equally, you've done that here to our community.
I grew up in a small community, and I wanted to settle down in a similar size community. When it comes to surgical procedures, the actual recovery process is kind of like a multidisciplinary approach. In addition to my role as a surgeon during the surgical process, there are a lot of other healthcare providers who are involved during the complete recovery process of a patient.
That teamwork, that cross-continuum collaboration, and people go to therapy and come back. Their follow-up visits all kind of in the same building.
When you're in a small town, you're easily accessible to these other healthcare providers. When there is a concern during the recovery process, they know how to get in touch with us.
Our team feel like you're accessible, and that if they see anything in the patient's course where they would need a physician input, that they know that they can just call you and you're there.
Exactly.
We're so glad you're with UnityPoint Clinic Orthopedics, and I know that we have a partnership with CNOS that has allowed that to happen.
This partnership has certainly helped us in providing that comprehensive care to the people of this community, and also in a very timely and efficient manner. As we know, medicine has a lot of innovations happening every day, and one such particular innovation in orthopedic surgery is the use of robotic procedures for replacements. What this technology involves is using a robotic arm that provides some life during the procedure using the trackers that we place on patients' extremity. And the robotic arm then helps us in making some precise cuts during the procedure. This eventually gets us a well-aligned joint and also a balanced joint. These in turn have been shown to improve the lifespan of these artificial joints, which is a huge benefit for our patients.
We're able to really look at the quality outcomes that are coming out of those replacements.
Also, other thing worth mentioning is the DNV certification that we got for hip and knee replacement procedures. They have reviewed all our procedures, all the protocols that we have in place, analyzed all our surgical outcomes, and they have certified that we do meet the highest standard of care that is on par with the national standards. And I think this is a big accomplishment for a community hospital and reassures the patient that they are receiving quality care right at their community hospital.
To ensure that our program was the top quality, that was a great way for us to affirm that through that national accreditation. So thank you for leading that.
So this aligns with our goal to provide comprehensive orthopedic care so the people of this community don't have to leave the town and they can get access to top quality care.
So it's joint replacements, it is fractures, you've got a pain in your knee and you don't know why it's happening. Your team has been able to support all of those kinds of problems.
Anything orthopedic related, our goal is to make sure they're able to get the right care somewhere close to home without the need to travel hundreds of miles.
It's been a pleasure getting to know you a little bit better, why you got into medicine, and of course all the great things that you're doing here. So thank you for spending the time today.
Thanks for having me.
And thank you for joining us today. We look forward to seeing you in our clinics.